more. Now, if you consider the neuron, where is the neuron?
That's the neuron.
Is all of it neuron?
All of our body, yeah, all of that neuron.
Is all of it neuron?
I think.
You see, just this is the neuron cell body, and inside this is neuron. What is this? What is this?
Melanin.
What is this? You know. So we have many types of cells which are called supporting cells. So we make a concept that we have got many types of supporting cells. They are called neuroglia. Neuroglia. So one is neuron and the other is neuroglia.
Sorry.
10% is neuron, 90% is neuroglia. What is neuroglia?
Support.
What is neuroglia? See.
Support cells.
It is the support cell, you see, which support, for example, we make this wall. There are cement blocks and there is cement. And there is different supporting material and this wall is made. So what are the functions of these neurons? Sorry, the neuroglia. One, astrocyte. This hold the neuron. Hold the neuron means it just keeps them together. This is astrocyte. So yani, if this neuron is to stay here, this is to stay here, so who is holding them? It is astrocyte. Then myelin sheath. Remember myelin sheath? Some neurons are myelinated, some are unmyelinated. So there is difference between central nervous system and peripheral nervous system. You know peripheral nervous system and central nervous system in the center, brain and spinal cord. Oligodendria, they form CNS myelin sheath. Try to understand because we will have some discussion on regeneration and nerve injury today on this. While Schwann cells, they form the peripheral nervous system myelin sheath. So prepare this for your MCQs. That is Schwann cell, this is peripheral myelin sheath. And the oligodendroglia, they are for the central nervous system myelin sheath. Then we have got ependymal cells that line the ventricles and microglia, which are macrophages for the central nervous system. Now, if the question comes, what is myelinated neuron? Please, whosoever comes, make a habit to close the door. So, what is the function of Schwann cells? Schwann cells, they form the myelin sheath. And for MCQ, you will prepare that Schwann cells, they form myelin sheath in the peripheral nervous system. Okay. So I told you that be careful about the figures. Now, what is myelination? Myelination is this sheet which is formed around a neuron. It is just like this, my sleeve. So this, how is it formed? This is formed by, the Schwann cell going around a nerve fiber. Okay, so this is the myelinated nerve. Now, myelination in the central nervous system is done by oligodendrocytes. Now I will not go back. So these points I am now explaining. Who makes myelin sheath in the central nervous system? Oligodendrocytes. Who makes myelin sheath in the peripheral nervous system? These are Schwann cells. So the same points that are written here, that is myelination in the central nervous system is done by oligodendrocytes. Now, you remember last week I discussed with you sarcolemma, and sarcolemma was the cover of the muscle. So here we have got neurolemma. So what will be neurolemma? Neurolemma will be surrounding the nerve fiber. Okay, so I'll go here and I'll come back. Now we are going to discuss that if nerve is damaged, what will happen. So basically, the nerves, they are like wires. So one small nerve fiber, many small nerve fibers, they are surrounded by connective tissue. Many such, they are together, and this all is one nerve. The concept is this, that for example, this fiber, this fiber, this fiber, they are for my hand fingers. One is moving the tip of the finger, the other is moving this over here, the next is moving like this, the next is moving this muscle, you see? But all the connections, they are together coming from the brain, from the spinal cord, they join together in the peripheral nerve. So this is one nerve. And you must have seen when they lay the cables, you know, for electricity or for data, you know.
Yes.
Now this has got many cables in it. One comes to his home, other comes to your home, and the next comes to your home. So it is just like this. That is, the nerves, they are arranged like this. We have so many diseases which you will be helping us with in physical therapy. These diseases, what is the topic?
Demyelination.
Demyelination. What is it?
Loss of.
I go back as usual. What is myelination?
It's the thing that covers the new.
What is the benefit? We have discussed it before.
It helps to make the signal faster.
Signal faster.
Yes.
Number two, the current is not leaked.
It
You
does-
see,
does
it is just like, if I find a wire over here, it is just like this wire. Consider that this is connected to current. Can I hold it here? Yes, no problem.
Yeah.
Because this is Garmos. Current cannot go out. So if it is not myelinated, the current will go in the wall, you know. Anything which is wet, it will have current. So this is myelin sheath. This myelin sheath is removed by many diseases. This disease group is called demyelination. Not one disease, many diseases. So this is called demyelination. It is the loss of the myelin sheath. Can you now imagine what will happen?
It won't send the signal. As
Can you now imagine what will happen if many of my nerves, they do not have myelin sheath? What
slow
will happen?
reaction.
What will happen?
Sensation.
Say, Yani, give more ideas.
The signal will be stored.
You
Signal will be disturbed, speed will be slowed, but what will happen? Practically all nervous system will be disturbed. There will be, like he said, different strange sensations. You know, the things which we do not want to feel, they will be coming. I am doing nothing and I have got stimulus here. I can feel something here, pain. And do you know a big disease, MS? Multiple sclerosis. It is very common. So you will be getting many patients in whom you will be helping them with their physical activities which are due to demyelination. So what is the effect? It leads to slow conduction of action potential or complete absence of the conduction because of demyelination. Can we get injury to the nerves?
Yes.
Can we get injury to the nerves?
Yes.
Can you repair the nerves?
Depends on the injury.
Can you repair the nerves?
Yes.
If you see, he's boldly saying no. For example, someone gets a bike accident and breaks his spinal cord over here, and all muscles they fail, and he's going quadriplegic. Yani all the four limbs they are not working. What can you do for it? Except for physical therapy, you cannot do anything.
There is some nerve injuries which need surgeries, and there is which just need time to recover and connect to each other again.
If this is what we are going to discuss. That is what nerves can get repaired partially. Maybe this, or maybe thulus, or maybe quarter, but not completely. But not one point, just because there will be 10 slides, but just pick up one point. In the central nervous system, you cannot repair it. Please look at me, no problem, you have seen it many times. In the central nervous system, you cannot repair. In the peripheral nervous system, there is some chance of repair. I go back. Can you repair this?
What is this?
No.
Is it central? No. This is
Yes. Main process.
Yes.
See, that is why I am wearing this coat now. If this sheet is there, this is made up of Schwann cell. If something cuts from here, this is nerve, okay? If something cuts from here, and this cell is alive, so this tube will be there. So the nerve can grow. But if you look at the central nervous system, you know, this cell is with this neuron and this neuron. This neuron is with this neuron connected with this. So you cannot repair it.
Yes.
Here they are separate. So we make a general formula that in the periphery, some repair is possible. Like Saleh said, that some injuries. Today I had a case, you know, my PhD student, she took a patient for drawing the blood from here. Very simple. But the technician was some untrained person. So he put needle like this and damaged the nerve. Although this is very small damage, but the lady, she's in the Mom Central Hospital. So she's getting current like things because the nerve is damaged. Inshallah it will repair in 3 days because the damage is very small, needle damage. What I am trying to tell you is this: if the damage is here or in the spinal cord, we cannot repair it. If it is in the periphery, there is some repair. Now, 10 slides, I will discuss the same point. So, basic idea was just this, that in central nervous system, repair cannot take place. In peripheral nervous system, some repair can take place. What is our topic? Our topic is nerve injury. The word is regeneration. Can the nerves regenerate? So we have answered that very limited powers. When we are about 6 months old, our nerves, they reach their level. Then as we grow up, become taller, then the nerves become long, but no new nerves are formed. This is the concept. So we say that neurons have very limited powers of regeneration. Neurons lose the ability to divide at age of
6
MCQ. Okay. So this is MCQ. I did not say that neurons do not become big. 6 months baby is like this. And my height is, like this. So growing is possible. But what is there? Division is not possible. You cannot have new neurons. Any neuron destroyed is permanently lost. Simple concept. You kill the neuron cell body. I go back, bad habit. You kill the cell body. Neuron is finished. You kill the cell body. This is remaining. It will die. What will happen if a neuron dies which is supplying my muscle?
Muscle dies.
What is the name for that?
Atrophy.
See? So this is the story that we are discussing. So only some types of damage can be repaired by nature, if Allah subhanahu wa ta'ala wants. We try to help, but we do not have much things to help. We can join two ends of a neuron with a small stitch and make dua that they join. But it is possible that a data cable is coming and someone has cut it. So one line is going here, one is going here, one is going here. When it is repaired, his line goes to him. It is possible because it is not controlled repair. Alright. So there is difference between regeneration between CNS and PNS, peripheral nervous system and the central nervous system. Did I tell you? Which one is possible?
Peripheral.
How much?
Little bit.
A little. That is why I said maybe less than 1/3, maybe quarter. Robot. So peripheral nervous system axons may be repaired. May means maybe, not sure. But what is the rule? The Schwann cells should be alive. If the Schwann cell dies, the neuron will never repair. Schwann cell, this coat, which is giving the coat. If it is there, now neurolema, this is half split over here. You will not see if you sit here. Number one, we can't, So neurolema, it is made by the Schwann cells, which wrap several times around a small part of the neuron. If it is injured, there is chance of regeneration. The rule is this, that neurolema forms a regeneration tube that guides and stimulates regrowth of the axon. So I do like this once again. Now the neuron is damaged, but the tube is there. You understand? So another one is here. So it can grow again. But if this tube is damaged, yani Schwann cell is damaged, then the thing can happen. 99% cases, Schwann cell is damaged. This is our problem. What will happen if we cut the nerve from here? Brachial plexus, cut.
To grow, there is a tube.
You know, some neurons might get killing of the Schwann cell. So there will be no growth. What can we try, the surgeons? We can try to bring together two parts of the nerve and make sure that they join. Very little chance. Very little chance. That is why the person who gets injury in the bike or the car accident and they break their spinal cord, we tell the relative on the first day, just pray, we cannot do anything. Yeah, they are so angry, they say, we brought the patient just now from the accident site and you say we cannot do anything. This is the problem. So, nerve regeneration is very difficult. This is what happens when a nerve is cut. Now this part is the cell body, this is alive. But this is joining with the nerve, the muscle. This is dead. Are you understanding what I'm saying? Yani this part is alive, no problem. Because it has the cell body, it has the mitochondria, it has the nucleus. But what about this one? It is not connected with the cell body. So this number 2, it will die. So part 1 is still living, part 2 will die. Dying is called degeneration, and the word which we are trying to learn is regeneration. Yani after death it becomes alive. Alright. So Schwann cells form a tube-like structure, like I said. If Schwann cells are not damaged, the growth will start again. This is dead. Nothing will happen here. So from here, the growth will start. Possible. But do you think that it will go to all the muscle fibers which is it supplying? That is why I said very small chance that something will happen. So this is the growth in myelin tube, and thus the regeneration is possible in peripheral nervous system, most important, sometime, not always. So this is the reason. In the central nervous system, as I told you, and for the last time I might go to that diagram, that one oligodendroganglia, it provides myelination to many axons, and one axon, it receives myelination from many oligodendroganglia. They secrete a special thing which is called growth inhibitory factor. If there is injury in the central nervous system, there is healing in a way that no regular tubes are left for the axon to grow. In fact, this area, it becomes fibrosed, it stops regeneration. So no regeneration in central nervous system is the rule, therefore there is no regeneration in the central nervous system.
MCQ. What? MCQ, the last one.
Yeah, of course, that is done. So, axons of the central nervous system are myelinated by oligodendrocytes and do not form neurolemma. Neuroglia of CNS inhibit axon regrowth. Possibly the same mechanism that inhibits axonal growth during development once a target region has been reached. Astrocytes invade the area, eat the tissue and make a scar tissue. Like we get the injury here and this becomes scar. So this is a dead region of the central nervous system. So what are the two reasons? So why regeneration is not there in the central nervous system? So inhibitory influences from neuroglia and absence of CNS growth seen during early stages of development. What am I saying? That now we are just finishing it. The growth stops at 6 months. This is what I am saying. Why it stops? Because growth inhibitory factors are there which stop the growth. This is what we are saying here, that there are two reasons. One is the inhibitory influence from neuroglia, and two, absence of CNS growth. Like a 6 months baby, the growth of the central nervous system, it stops. And last of the boring slides, many broad flout processes spiral around the CNS axons and deposit a myelin sheath, but neurolema is not formed. Axon in the CNS display little regrowth after injury due to absence of neurolema and inhibitory influence exerted by CNS neuroglia. So can you tell me why I took 10 slides for this?
Because everything is based on...
There is one or two MCQ here. But this is, have you made your concept clear that you can just help with physical therapy a patient who has got nerve damage? And your 90% patients, I told you, they will be like this. Yani, few patients are there who have got arthritis, joint pain, or muscle cramp, or sport injury. But most of the patients, they will be there with the nerve injuries, with stroke, shell, paralysis, with cut, Erb's palsy, things like this. So your mind should be clear that he cannot be cured. You know the difference between treatment and cure?
Yes.
You can be cured of influenza. You can be cured of flu, inshallah. Your infection can be cured, but your diabetes cannot be cured. It cannot be cured. Your cancer cannot be cured. You understand? So CNS damage cannot be cured. Peripheral nervous system damage, very small chance that it gets cured, but it can be treated. This is your job. This is your job. Now, half of the nerve is dead. We know it is cut from here. Now this hand will be fine. These muscles, they will start becoming atrophied. He cannot move. Your job is to keep this muscle look like this and help them to restore some activity. At least they can hold a spoon and gradually bring it here. This is what I am saying. It cannot be like this. But in 1 or 2 years with good physical therapy, they can hold with 2 fingers and bring it maybe like this. This is enough. This is what I was saying, 1/4 or even less than that. All right. So now tell me something about autonomic nervous system.
Should we tell?
By the way, next week, inshallah, we'll be starting with motor system. You have 6 lectures of motor system with me, then you will switch over to sensory system. So these details will be discussed there. But this topic will be finished, inshallah, in the next.
Physiology, this we were talking about just motor and sensory nervous.
Yani, I didn't understand your question.
In this
Semester.
Yeah.
Did you get the timetable? Otherwise, Saleh will send you once again. So we have many topics, not just motor and peripheral. All right, so please help me with autonomic nervous system without looking at the slides. What is autonomic nervous system? How is it different from somatic nervous system? What are the parts of the autonomic nervous system? What functions autonomic nervous system perform? Are these voluntary functions or involuntary functions? So tell me something. Start from somewhere, yes? Yes.
Involuntary.
So autonomic nervous system comes from the word automatic. So it is autonomous. It is controlling, it's controlling the functions which are not in our mental control, which is not in our mind control.
Slides. Share slides.
What are the parts of autonomic nervous system? Without looking at the slide. I said without looking at the slides.
Well, The body.
Spinal cord.
The cardiac.
What are the parts? What are the parts of the nervous system?
Peripheral, central.
Okay, you can say peripheral or central, or you can say autonomic and somatic. Okay. Parasympathetic and sympathetic. That is why I am pushing you that you bring that. Please stop talking. I get disturbed. Whatever it is, whether you are telling him that I know a lot, this is the slide. Okay. Just a teacher gets disturbed. Number one, you came late. Number two, now you are disturbing me. Okay. What was I saying? Yes. So I am trying to bring these things out of you because you know all these words. Do you know the word neurotransmitter? Have I discussed it with you?
We just with first.
Neurotransmitter.
Yes.
Remember? Do you know the neurotransmitter of parasympathetic system?
How to see?
I am not saying anything, just trying to dig your brain.
Zone.
Okay, I'll help you. Do you know what is the neurotransmitter when we are in flight, fright, emergency?
Adrenaline.
Adrenaline. Adrenaline. Okay, or noradrenaline. So this is sympathetic system, which is our emergency system. So what is the neurotransmitter? Noradrenaline. The parasympathetic system has acetylcholine, which we have discussed so many times. Parasympathetic system has got acetylcholine. Acetylcholine acts on the receptors which are called cholinergic receptors. From acetylcholine, from choline we have got cholinergic receptors. See? And noradrenaline will act on what receptors? Or adrenaline will act on what receptors? So, say, doctor, we don't know. No problem. Everything is on the slide. I'm just, trying to pull out a few things from you. Like acetylcholine, we have got cholinergic. So from adrenaline, we'll have adrenergic, cholinergic, adrenergic. So cholinergic is for parasympathetic. Adrenergic is for
Sympathetic.
Now my blood pressure increases. Which system will increase my blood pressure?
Sympathetic.
Okay. Which system will increase my heart rate?
Sympathetic.
Which system will increase my digestion?
Parasympathetic.
Which system will stop me from passing urine?
Parasympathetic.
Listen. Stop me from passing urine. Listen. We both are in fight. And I tell him, I'll fight you, but wait, I'll go to washroom, come back.
No.
Is it normal?
No.
So sympathetic, it stops the urine, yani it stores the urine.
You say that.
Now the fight is finished, or the class is finished. Now I go to the washroom. Parasympathetic, it causes passing of the urine. Now when I am in fight, do I need more oxygen or not?
Yes.
So what will sympathetic do to my bronchi?
Expand.
Expand, the word is dilatation, okay? Bronchodilation. So sympathetic causes bronchodilation. You understand?
Yes.
Now listen. Let's go to pharmacology of medicine. If my blood pressure is increased, now forget about controlling my salt and water and things like this and food. If you want to give a medicine, what type of medicine would you like to give to me? Which stimulate my parasympathetic system? Which block my parasympathetic system? Which stimulate my sympathetic system? Which block my sympathetic system? Try to understand. If you give me more adrenaline, my blood pressure will be
High.
even more higher. If you give me parasympathetic medicine,
No.
it will decrease my heart rate, decrease my blood pressure. Or if you give me a drug which blocks the sympathetic system, yani block the adrenaline, it will make my blood pressure low. So we are just making this concept. It is not controlling our muscles, but it is controlling our glands, autonomic nervous system. It is controlling our blood vessels. Mostly it is very fast. It is controlling all the smooth muscles. It is controlling the heart. It is controlling our breathing. It is controlling our intestinal secretion and motility. It is controlling our sexual activity. You understand?
Understand.
Is sexual activity, listen, try to understand this, because when the boys are here, I can discuss the topic easily. When the mixed class is there, then I don't discuss. What do you think? Is sexual stimulation voluntary or involuntary?
Involuntary.
It is involuntary. You see? I am not saying sexual action. That is having voluntary part as well. But sexual,
Feel.
it is what we call erection.
Oh.
It is involuntary. Again, you will not have erection while fighting. You understand?
Yes.
So this is not sympathetic activity. This is sexual activity is an activity of rest. You understand? So the concepts are now clear. We have covered urine passing. Just like that, we have got stool passing. You have covered the stomach. You have covered the intestine secretions. You have covered the, for example, pupil, bobo. I am in a fight.
Dilatation.
Dilatation. So sympathetic will cause dilatation. Parasympathetic will cause constriction. There is only one surprising thing. Salivation. Yani producing more saliva.
What?
Saliva. You know saliva?
Sympathetic?
Yeah.
Saliva. So it is strange. What happens to your mouth when you are in a fight?
Twice?
It becomes dry. So you will logically say that sympathetic decreases saliva. But no, saliva does not decrease, it becomes more thick. The water in the saliva, it decreases. So subhanAllah, sympathetic, parasympathetic, both cause increase in the saliva, but we say parasympathetic increases the volume of saliva. Because our experience, when we are in khawf or anger, our mouth becomes dry.
What?
So because sympathetic, it secretes saliva minus less water, not much water, so less saliva. But we say parasympathetic, it increases. So my dears, what is the anatomical difference? We start from here. What is the anatomical difference? From where the autonomic nervous system comes from? Is it connected with the central nervous system? You see, so just like last lecture when I had two boys coming to me and I made the concept of actin and myosin muscle contraction. You remember?
Yes.
So here again we want to make a concept. Autonomic nervous system is away from the central nervous system, but it gets a fiber from the central nervous system. This concept we make first and then we move further. Alright. So we start with this discussion on autonomic nervous system.
We open the slide.
Yes, yes. That was just for the brainstorming that I wanted you to close the slides.
Okay.
It is the domain of the nervous system that regulates the activities of smooth muscle, cardiac muscle and glands. What is left? Skeletal muscle. Yani, I tell the students like this, take something to eat. Is it autonomic nervous system?
No.
No. Put this thing into your mouth. Is it autonomic nervous system?
No.
No. Now chew it. Is it autonomic nervous system? No. No, no, no.
The salivary.
He's saying saliva. No, I'm not saying saliva. I'm just saying chewing.
Oh, chewing this.
Now listen. Now make. This is called swallowing. Is it autonomic nervous system?
What's enough? Yes.
No, again, it is my voluntary will. If I don't want to take it in, I don't take it in. After that, there is no voluntary control. It is here, food is here. Now it goes down by peristalsis or whatever happens till the end. We cannot control it. We can control only one thing. What is that? Yani, I want to pass the stool. but I don't pass it here. I can stop it, excuse me, and I go to the toilet, and now I release my sphincter. That is voluntary. You understand?
Yes.
Just like that, the last part of the urine. Yani, my bladder is full. It is bursting. I am a student in the class, and my teacher, he doesn't like that I take permission to go to the washroom. I will not pass urine in the class. I will hold it, make my legs like this. You understand the concept? Then I run to the washroom. I don't pass the urine. I don't wet my pants. I reach the washroom. It is closed. There is a boy inside. I don't pass the urine. Yani, up till here it is autonomic nervous system, but passing the urine, the last step, it is voluntary if I am not a small baby. Or if I am not a cat or dog on the road. If it is a cat or dog in your house, it can also stop the urine. Because you have trained it. When we were small, we passed the urine like the cats and dogs. Without control. Bladder full, we pass urine. Father has come, he says, "MashaAllah, my son is so good," and I make urine. You understand? On his face.
No.
No, it is, inshallah, Allah subhanahu wa ta'ala will give you son.
Yeah.
You will have this.
I
You
will
will
be-
enjoy this.
I will be careful.
You can't be careful with son. Okay. Now we train. So babies, they are trained by mother or grandmother or whosoever, where to pass urine, when to pass urine, thing like that. Yani you are controlling only the last part, which I will tell you inshallah in another 15 minutes. This is called the external sphincter. You can only control the external sphincter. How many parts of the autonomic nervous system?
Two.
Can you name them?
Sympathetic nervous system.
What word? What does sympathetic mean? What does parasympathetic mean?
Sympathetic
Fi-
fighter.
It is fight and flight, emergency. And what does parasympathetic mean?
Rest
Yes.
and digest.
So we have got this diagram to make the concept. Parasympathetic, it is rest and digest. Sympathetic, it is fight or flight. All right? My dears, let's make the concept. I told you it is connected with the central nervous system. So one fiber, it comes from the central nervous system, which I will discuss in an organized way with you. I am purposely doing it. What is it telling us? What is the title?
The type. Not the
Sympathetic.
Sympathetic outflow. Where does the sympathetic nervous system get connection with the central nervous system?
Lungs.
See the diagram.
Yes.
See the diagram with me or on your slide. Why I am doing like this? Because this you cannot do it on your slide.
Oh, yes.
What am I discussing? Anatomy. Of which part of the autonomic nervous system? Sympathetic. From where it is connected with the central nervous system? It is connected in the thoracolumbar. Thoracolumbar. What is this? Cervical. What is this? Cranial. What is this? Sacral. Now see here. What is this?
Parasympathetic.
Parasympathetic. After this, I will give you time to see your slides. First see with me. This is parasympathetic. From where it is coming?
Cranial and
Yes, it is coming from cranial and sacral, from which sympathetic is not coming. You understand? Now you can see it on your slide and make the concept. This is pure anatomy,
Yes.
but we have to learn it. This is what we call physioanatomy.
Cervical have nothing to do, neither side.
What?
Cervical. It's both.
Yes. Yes. So cranial, is with parasympathetic. Sacral is with parasympathetic. So we say craniosacral origin is for parasympathetic. And thoracolumbar is for?
Sympathetic.
How many thoracic nerves do we have? How many thoracic vertebrae do we have? 12. How many lumbar do we have? 5. So 17 points from where central nervous system connect with what? Let's name one new thing. This is called ganglia. Wahid is ganglion. Jama, ganglia. Wahid is nucleus in central nervous system. Jama is nuclei. You remember?
Yes.
So parasympathetic, now I will jump few slides and then I come back to this. Parasympathetic and sympathetic nervous system, they are actually starting from the ganglia. Wahid is ganglion, okay?
Yes.
The fiber from central nervous system to ganglion is called preganglionic, yani kabal ganglia. And the fiber after is called
Ganglion.
postganglionic fiber. This reaches the smooth muscle or the heart or the gland. Are you with me?
Yes.
This is exactly what is shown in this diagram, but this diagram is not good. So have you made the concept? Autonomic nervous system has got ganglia. Ganglia is connected on one end with central nervous system with preganglionic fiber. Ganglion is connected with the effector, which is smooth muscle, cardiac muscle, or the gland, and this is called postganglionic fiber. What are you doing, my dear, with mobile, please? Typing.
I write the notes.
Okay. But try to bring something big, you know, that is, a teacher is enemy. A teacher is enemy of mobiles.
No.
You hide it, teacher can see it. You know, like I'm seeing him as well. No problem. Just concentrate over here. Have you made the concept which I told? What did I tell just now?
I don't think you say now.
Yani, what did I tell?
You talk about the parasympathetic system and sympathetic system.
No, this point.
I write the notes.
Okay, you win, I lose.
Just,
You are right. Alas, no problem. Putting something in your brain is not my job. What is preganglionic fiber? Can you define it? Preganglionic fiber. Can you define it? From central nervous system to the ganglion. Can you define the postganglionic fiber?
From ganglion to
From the ganglion to the effector. Can you name the 3 effectors of glands,
muscle smooth.
cardiac muscle, and smooth? Alright, so now I go back and now I ask you the final question. What is the origin of sympathetic system? It is thoracolumbar. Okay. What is the origin of parasympathetic nervous system?
Craniosacral.
It is craniosacral. Alright. This is giving maximum MCQs and EMQ. So this slide is most important. So here you can also write here that this slide is important. Okay.
Take it from him.
Okay. What is the effect of parasympathetic system on pupil? You see, I just now discussed these things with you. Constrict. And what is the effect of sympathetic system on the pupil? Pupil is bobo. This, okay. What is the effect of parasympathetic system on the heart? Slow heart rate or heartbeat. And of the sympathetic system? Increase heart rate. Why?
Fight.
Yes, he says to fight. Yani, I want more blood supply to my organs.
Supply oxygen.
Yes. Okay, what is the effect of parasympathetic on the bronchi? Constrict. Sympathetic on the bronchi?
Relax.
Relax. Now exact opposite will happen. Yani we reach GIT. What is the effect of parasympathetic on stomach activity?
Stomach.
What is the effect of sympathetic system on stomach activity?
Habit.
What is stomach activity?
Digestion.
2. What is stomach activity? Secretion. And 2.
Digestion.
2. 2.
Cell.
Mixing. Stomach just mix. Have you seen that truck which brings concrete to make the roof of the house?
Yes.
It is just going like this all the time. When it is going on the road or whatever it is mixing the concrete. You understand? So, what is the effect of parasympathetic system on the liver? Inhibit glucose release. And sympathetic, it stimulate glucose release. Why?
Energy.
Because glucose is energy. We need energy for fight, for emergency. Finally, what is the effect of parasympathetic system on the sexual arousal? The word is arousal. Arousal means stimulation. So sympathetic, it inhibits. Parasympathetic, it stimulates. But my dear, now listen, that is why I said this topic is taught well just if I am teaching the boys. Once the sexual activity starts, then it becomes emergency. So the last part of sexual activity, when we finish the sexual activity, this is ejaculation. Yani when semen comes out. This is sympathetic. Does it make MCQ? Does it make EMQ?
It does.
So this slide is
Very important.
up till now the most important one in the autonomic nervous system. The rest I will just explain all these things in a faster mode. So I told you the autonomic nervous system, it is made up of a ganglion, a preganglionic fiber and a postganglionic fiber.
What's
The pathway of the autonomic nervous system is from central nervous system to effector. This pathway consists of two neuron chain, yani preganglionic fiber and postganglionic fiber. This is called autonomic nerve pathway. And we will discuss the difference between the two. Yes.
the three effectors? What was it?
Again,
The three effectors.
the three factors you tell me.
Yes.
Help him.
Muscle.
Not which muscle? Smooth muscle,
Cardiac.
cardiac muscle,
Glands.
glands.
Okay. Thank you.
3 types, but not skeletal muscle. This is our whole story. Because skeletal muscle is in my mental control, voluntary control. The cell body of the first neuron lies in the central nervous system, here. The cell body of the second neuron lies in the ganglion. What is ganglion? It is a group of neurons located outside the central nervous system. It is not in the central nervous system. Preganglionic fibers have cell bodies in the central nervous system, like spinal cord and the brain, craniosacral or thoracolumbar, as I told you. Their axons are myelinated. Now when I write for the postganglionic, remember, this is important point. The axon terminal synapse with one or more postganglionic neurons. Now read. Postganglionic fibers are
Myelinated.
unmyelinated. Preganglionic fibers are,
Myelinated.
postganglionic fibers are
Unmyelinated.
unmyelinated. Where does the preganglionic fiber start?
Central.
Central nervous system. Where does the postganglionic fiber start? Ganglion. Where does the preganglionic fiber end? Ganglion. Where does the postganglionic fiber end?
Effector.
Effector. What is the neurotransmitter of
You read the thing?
No, I'm just saying general idea
Oh.
of parasympathetic system and sympathetic system. Before that, we have to make a strange concept that acetylcholine is present at 4 places.
Oh.
I repeat once again. What is the neurotransmitter of parasympathetic when I started discussion? It is acetylcholine. And what is the neurotransmitter of sympathetic system or emergency system? Better we say noradrenaline, okay? They are sisters. Adrenaline comes from our adrenal gland on the kidney. Noradrenaline comes from the nerve fibers. Okay. Nor does not mean no. Nor means nitrogen cohone radical. Don't learn it, but I'm just telling you, it is a type of adrenaline. Okay. So my point here is this, that acetylcholine is at 4 places. I go back before I do this slide. Preganglionic fiber is present in both sympathetic and parasympathetic system. Agreed? At this place it is acetylcholine. What is this? It is synapse. So preganglionic fiber of both sympathetic and parasympathetic, they use acetylcholine.
Is there a short for acetylcholine?
Yes,
Oh,
it is there on the
yeah,
slide.
I see.
ACH. All right, don't worry. We'll start once again. So acetylcholine, this is the short. Can you see?
Yeah.
The fibers which secrete acetylcholine, they are called cholinergic fibers. I told you in the beginning. They are at 4 places. What are those 4 places? So all sympathetic preganglionic fibers, all parasympathetic preganglionic fibers, all parasympathetic.
Yeah.
What is this difference? Postganglionic fibers. And few sympathetic postganglionic fibers which supply sweat gland, blood vessel of skeletal muscle, skin and external genitalia. I repeat once again, go back to this diagram for the final time. This place neurotransmitter is always acetylcholine, whether it is sympathetic or parasympathetic. So I say preganglionic fibers of sympathetic, acetylcholine. Preganglionic fibers of parasympathetic, acetylcholine. But here, yani postganglionic fiber, only parasympathetic, all of them they have got acetylcholine. But some sympathetic, like the ones which are supplying the skeletal muscle blood vessel or the blood vessels of the genitalia or the sweat glands, they also have acetylcholine. So this is written over here as 4 points, and acetylcholine is quickly inactivated. This is second difference. So the effect is very fast. It is quickly inactivated. We discussed first neurotransmitter, acetylcholine, and we come to the concept, half of which you know. Last time someone mentioned muscarinic. You remember someone mentioned muscarinic. So acetylcholine or cholinergic receptors, they are nicotinic receptors or muscarinic receptors, 2 types. We go to the next one. Name is norepinephrine or noradrenaline, same. It is released only at 1 place, not 4 places. And this is most sympathetic postganglionic fibers. So most sympathetic postganglionic fibers, they have got norepinephrine. The nerve fibers which release it, they are called adrenergic. I started with cholinergic and adrenergic concept. So the nerve fibers which release norepinephrine, they are called adrenergic. This is slowly inactivated. You remember what I said about acetylcholine?
It's 4 places and pre and post.
What I said about acetylcholine?
Okay.
Quickly inactivated. But it is slowly inactivated. Therefore, the effect remains for a long time. Comparatively long time. You see, you made me angry. And my anger stays for 10 minutes. And then I cool down.
Yes.
You understand? So my blood pressure will come down after 10 minutes maybe, or maybe more. My heart rate will come down after a lot of time. But what is this is so fast because this is dependent on acetylcholine in neuromuscular junctions. Although this example is from voluntary control, but exactly like this in our body, acetylcholine action, it is very fast. All right, finally, receptors for norepinephrine are called adrenergic receptors. Like in acetylcholine, we had cholinergic receptors. In cholinergic receptor, we had two types, muscarinic and nicotinic. Here we have two types, alpha receptor and beta receptors. This is what I told you. If you want my blood pressure to come down, you will give something which blocks my beta receptor. If you want something, some given to me to decrease my heart rate, which is always increased, you will give something which is alpha receptor blocker, some medicine. So this is the story of the neurotransmitter. Last line for both, the blue one, acetylcholine is neurotransmitter for parasympathetic system. And the blue one for this one, norepinephrine is neurotransmitter for sympathetic system. All right. Now, another slide for MCQ. Here we have got a contrast of parasympathetic and sympathetic. We are mixing physioanatomy points here. They're not just physiology. So point number one, we'll just go through these 6 points and then you will prepare it for your exam whenever you are preparing it. This is summary of my 15 slides of autonomic nervous system. What is the origin of preganglionic fibers in sympathetic, thoracolumbar, and in parasympathetic, craniosacral? Remember the first slide?
Yes. Diagram.
What is the length of the fibers in sympathetic? Preganglionic very short, postganglionic very long. In parasympathetic, preganglionic long, postganglionic short. Synapse of the preganglionic fibers on postsynaptic neuron in sympathetic. Each preganglionic fiber synapses with many postganglionic neurons. And here with just a few postganglionic neurons. Distribution sympathetic throughout the body. I need all my body for fighting or for running away. So it is distributed throughout the body. Every blood vessel, every sweat gland. You understand? So it is spread all over the body. To the heart, to the atria, to the ventricles of the heart, to the lungs, to my spleen, to my pancreas, everywhere it is there. But in case of parasympathetic nervous system, it is, not distributed throughout. It is in the head. Head means eyes. Head means nose. Head means mouth for salivation. You understand? And in my boxes. I have 3 boxes. 1 box, 2 box, and 3 box, pelvis. You understand? So in these boxes, it is thorax, abdomen, pelvis, and head. Chest, abdomen, pelvis, and head. Does heart have parasympathetic nerve supply? Yes. Does my leg have parasympathetic supply?
Yes.
No. Try to understand. I repeat once again. Sympathetic is supplied to all the smooth muscles of the body, to all the glands of the body, and to the cardiac muscle. Agreed?
Agreed.
So all means all. Do I have smooth muscle in my leg?
Yes. No.
Smooth muscle.
Where? He says yes. In my blood vessels, arteries, veins. It has smooth muscle. Agreed?
Agree.
Do I need to dilate my blood vessels in the muscles when I am playing football?
Dilate? No.
Or yes,
Dilate?
dilate to supply more blood to my muscles. If you constrict it, less blood will go in the muscles.
Okay.
That is why Allah subhanahu wa ta'ala has made a separate neurotransmitter for the blood vessels of the skeletal muscle. See, this is what is written here. They are totally different. The blood vessels of skeletal muscle, they are having acetylcholine. That is why they are different. Alright. So sympathetic is supplying all the body. Now parasympathetic, is it supplying the blood vessels of my muscles? No. Of my veins? No. Is it supplying my intestine? Parasympathetic?
Intestine?
Yes. Yes, because it is inside. Is it supplying my kidney?
Yes.
Yes. My ureters?
Yes.
Yes.
My lungs?
Yes.
My heart?
Yes.
Yes, yes. Thorax. Parasympathetic.
Parasympathetic.
But I said parasympathetic is not supplying the blood vessels of the muscles. Alright, so this concept we make. Activity. Which one discharges in the stress and anxiety and fight and flight? Sympathetic. Which one discharges in rest and sleep?
Parasympathetic.
Why you get diarrhea in the exams, or you don't want to eat, your food is stuck up here when you are in the exam season?
Stress.
Yes, what happened? Because you are not resting properly. You need to rest for digestion. If digestion is not proper, it happens to us all the time. Why people who are always in stress, they get different diseases of GIT?
Yes.
You understand?
It makes sense. Yeah.
Now this is the story. We teach this to the medical students in maybe 2 weeks, this point. Maybe 6 lectures. But you have understood it that in a very simple way, that if we don't take rest, there is no digestion. Here always I again make a joke which is making understanding. A patient came to me and he said, I don't have any children. I am married for 3 years. So I took history like we take the history. What do you do? Where do you live? Thing like this. He says, I work 6 hours away from my home where my wife lives. So I only come on the weekend. And I am always in stress because I have so much work, I bring my work with me. And this. I said, first take your wife with you to where you work and then come back to me after just 6 months. You understand? So this is not a joke, this is actual what I was telling you.
He did it.
Huh?
He did it.
Yeah, leave the rest of the part, but have you understood this part? Yes. Of course he did it.
Smart.
There are problems in the families where and people with less income, they cannot take their wife from the family home to, for example, he's working in Riyadh. So he will not take it. But still, he understood the point. When he comes tired from Riyadh, reaches here, Khobar, he has just few hours with his wife, in which his mother is there, father is there, other people they are there, plus he has stress of many things. Anyway, so response. Generalized response in the body because of the wide distribution of fiber. Sympathetic, general supply. Generalized response. I am in anger, every cell of my body is under the control of sympathetic system. I say every cell is angry. But parasympathetic system, it is just supplying some organs, not everything. Alright? This is the repetition of same slide. Which slide? This one. Before this one. This slide. Okay? So this is, because it is so important, and many of you, by bad habit, what is the difference between A and A plus? A plus student always prepare the figures. And the rest of the students, they don't prepare the figures. For the rest of the students, we have made just this table so that you could do the same ones over here. I, sympathetic, dilatation. Parasympathetic, constriction. Sweat gland, increased secretion. Parasympathetic, no effect. Lung, bronchodilation. I am not reading it, okay?
Yes.
This is same which I discussed with you before. There is one new over here.
This is it.
The last one.
You
Because next topic is urine. Yes. Urinary bladder, sympathetic. Did I tell you about this? Do you want to pass urine while you are fighting?
No.
No. So the bladder relaxes. and there is storing of the urine. But the sphincter contracts so that I don't pass urine while fighting. And now I am in peace, not fighting, resting. So parasympathetic, it causes contraction of the bladder and relaxing of the sphincter. So we can pass urine. This is our next topic, which we will discuss after 10 minutes. Come back quickly, okay? Because we started late. Or you want me to continue?
Continue.
Continue?
Talking-
Oh, khalas.
just-
Doctor, I have a question. Why some hair is urine?
Why someone is?
Hair.
Yes. See, what he's saying is this, that some small kids especially, when they are afraid, for example, a dog is running after, he will pass urine. This is his very valid point, you know. Some small animals, this is jibilla, you know jibil? Fitrat, yani.
Oh.
It is our nature. Some small animals, when, for example, a small animal is trying to save its life, a big animal is running after him to catch him and eat him. So he passes urine and stool as a defense mechanism so that the animal which is coming after stops for 1 second to smell it.
Make sure.
You understand?
What is this?
So this 1 second is enough for that to go this or up the tree. So this nature is still there in some of us. So I fully agree with this point. Not all. Some people in very much off. But there is one more thing. The females, the ladies, especially who have given birth to multiple children, 1, 2, 3 children, their pelvic muscles, they become very weak. They laugh, they pass urine. You make them laugh, they pass some drops of urine. They cough, they pass some drops of urine. This is called incontinence. So it is more common in the ladies who have given birth to some babies. I agree with your question, but general rule is what we are discussing over here. So my dears, we have got 2 examples of the autonomic nervous system function, but I have already discussed them with you. One is passing of the urine, the other is passing of the stool, which is called defecation. All right. So our urine is stored in the urinary bladder. It comes from the ureterus. We have got number 1 stop. This is called internal urethral sphincter. Do you know sphincter?
Yes.
Say yes, no.
Yes.
All of you, this is sphincter. This is sphincter. This is dilated, urine can pass. This is constricted, urine cannot pass. So wherever we have internal, we have external. So we have one external sphincter. Now, very simple. This place is not in my control. What is not in my control? Urinary bladder. This place is not in my control. What is not in my control? See.
Urethral.
Internal urethral sphincter. But this place is in my control. What is this? External urethral sphincter. 2 things are not in my control. The thing which is in your control, is it controlled by autonomic nervous system?
No.
No. So we have got a nerve, special nerve, which is called pudendal nerve, which controls this area. Again, boys class, it's very easy for me.
Yep.
So girls class, I don't teach like this. Just concentrate on the area of your penis and anus. Can you constrict that area? Do it now. Do it now.
Yes, we
Do it now.
Doctor,
Do it.
we can. Wallahi, we can. خلاص.
Just keep quiet and do it. Don't answer me.
طيب.
This means this area is under our control.
It is our under control.
This is in our control.
Yes.
So we have learned we cannot control this area, but we can control
This external.
external. I have taught you both together. For the stool also I will say, I will repeat the same. And by the way, why did I do this with you? And Salim made his hand with like this. No, you will be training many patients for exercise of these muscles.
Even pregnant women.
Yeah, especially different types of women who have got multiple injuries to their sphincter, and you train their pelvic floor. Just like what I told you. You will do the same thing.
No.
Yes, Lazim, this is your job, physical therapy. Please, can you describe this diagram for me?
The nerve supply.
Who will describe this? Starting from, we have got sympathetic coming from L2. Please. Which is supplying the bladder and internal urethral sphincter. Listen, please, I need your attention. I am not enjoying.
No.
One is sleeping and the rest are awake but open eyes. Listen. Internal sphincter, bladder, external sphincter. Okay?
Okay.
Now describe the nerve supply to me. The sympathetic is supplying the bladder body. Agree?
Yes.
agree.
And the internal urethral sphincter. But it is not supplying the external sphincter. Parasympathetic coming from S2, S3, S4. Remember, it is craniosacral.
Yes.
So S2, S3, S4, the green one, it is supplying the bladder, body, and the area around the internal sphincter. Agree?
Yes.
But it is not supplying the
External.
sphincter. A nerve which is called pudendal nerve, which is not sympathetic, which is not parasympathetic. See, this is sympathetic, this is parasympathetic. So this is somatic nerve, which is in control of my brain, which you experimented just now. It is controlling external sphincter, but not or the bladder body.
Understand.
Okay, so this we understood, and now we have written this same on the next slide after 2, but first we do it. How do we store urine? Answer is very simple. It is written here. Parasympathetic inhibited, because if parasympathetic is stimulated, the bladder will contract. Sympathetic excited, because when it is excited, the bladder is relaxed. When it is excited, the sphincter is closed. And the pudendal nerve excited, because when it is excited, the sphincter is closed. I repeat once again. For storing of the urine, the bladder should be relaxed. It is relaxed when there is sympathetic stimulation, because we don't want to pass urine. We store the urine when this sphincter is closed and this sphincter is closed. This sphincter is closed when the sympathetic system is excited. This sphincter is closed when the voluntary or pudendal nerve is excited. And now we want to pass urine. How will we pass urine?
Relax.
Number 1, number 2, number 3.
Oh, okay.
We will stimulate. Very good. So parasympathetic will be stimulated. It will contract the bladder. And we will inhibit the sympathetic and pudendal. So this is open, this is open. This is relaxed. So the urine passes. So this is MCQ, MCQ, and MCQ. But this is a formula.
It's AQ.
You can make a CQ as well from here.
Okay.
The formula is there. Sympathetic stops or stores. SS. Okay? Yani sympathetic stimulation, it prevents the urine to pass. So who stores? Sympathetic. And parasympathetic is with P. So PP passes. Parasympathetic passes urine. Okay?
Yes.
So my dears, when the bladder is full, number 1. Number 2, we feel like passing urine. But number 3, we constrict our external urethral sphincter so that we do not pass urine. Number 4, when we relax the external sphincter, the urine is passed. This is called the process of passing of urine. Why do you feel urine? Because of the stretch of the bladder when it is full of the urine. This is, detail is written here in the end. What is the word for passing stool? Baraz. Defecation. What is the word for passing urine? Ball. Micturition. Okay. So the word for passing stool, defecation. I ask you a question, especially those who belong to villages. Have you ever felt that when we take food, and especially heavy food, we feel some stimulus for passing stool?
When it's
This is natural.
going out.
It is not going out. It has just reached the stomach. But the food which is finished, digested, and some remnants are there, it is there in the colon. It wants to make place for the next one. You understand? So this is what I am going to discuss with you right now in few steps. Step number 1 is stimulation of the stretch receptor. When there is stool here, what part is this?
Canal.
Rectum.
Very good. Very good. This is rectum. This is anus. This is the sigmoid colon. Sigmoid colon. Yani it is colon last part.
Yes.
Sigmoid colon. It is like S. And then there is rectum. And then there is anus. Do we have control here?
No.
Do we have control here?
No.
Do we have control somewhere here?
No.
Do we have control here?
Yes.
Yes. What is the name? External sphincter. And we have internal sphincter just close by, for which we do not have control. But the nerve supply is same story. Minus sympathetic. Sympathetic we will not discuss. You remember parasympathetic coming from S2, S3, S4 in this diagram?
Yes.
Remember?
Yes.
So same S2, S3, S4, they are here. They are supplying the internal sphincter and they are supplying the sigmoid colon and this. What is the stimulus for defecation? Presence of stool leads to stretch. When there is stretch, the reflex is to relax the sphincter and pass the stool. Try to understand, very simple. This is the tube. And this is the mouth of the tube, okay? So this is closed. This tube is now full of feces, stool, okay? And this becomes stretched. Spinal cord S2, S3. What is the reflex? Open it. But will you open it here?
No.
So that is why Allah subhanahu wa ta'ala has provided with the pudendal nerve, which is controlling the external sphincter. Which is controlling the external sphincter. So once again, this is sigmoid colon or rectum, this is internal sphincter, and this is external sphincter. Okay? So sigmoid colon, it becomes stretched by the stool. Internal opens, because this is reflex, but external is closed, like I did.
Yeah.
Now this is the proper place. Now you go to the washroom, sit there, you are in comfort, and you relax. What is constipation? Constipation in Arabic?
I'm not sure.
What is, give me the word constipation. Anyone knows? When you cannot pass stool, it is very hard.
امساك.
Imsak. I was thinking qabd, something like this. Imsak. What is the reason for that? The first reason is this, that we stop our stool when it is time to pass the stool. The second is this, that we don't drink enough water.
Or we can't just digest something.
What is the function of colon?
Take water before it goes out.
What is the function of colon? Yes, say it another way. He says,
Reabsorb it.
yes, reabsorb the extra water. Colon makes the stool dry. It drinks. We say we digest through small intestine. We eat through small intestine because it takes the food. And large intestine, it takes in the extra water. You understand? What will happen if you leave the stool for 24 hours in the large intestine? All the water will be reabsorbed. And it will become like,
Diarrhea.
no, other way, hard.
Oh.
If you leave it in the large intestine for less time, it will be diarrhea. Because there is not enough time to drink the water, to take back the water. So my dears, this is the story which now we explain in multiple reflexes. For example, if there is more food in the stomach, we feel like passing stool. If there is more food in the duodenum, we feel like passing. So the stimulus is stretch, the response is relaxation of the internal sphincter, and the thought process is that we relax the external sphincter by stimulating the pudendal nerve. This process is called defecation. Defecation reflexes are two types: intrinsic defecation reflex and parasympathetic defecation reflex, which is controlled by autonomic nervous system. Our topic was the passing of the stool, which is defecation. It is stretch of the rectum which stimulates defecation. The intrinsic defecation reflex is through the myenteric plexus, which is in the wall of the colon. It causes the muscle of colon to contract and internal sphincter to relax. So the sphincter relaxes and the stool goes outwards. Defecation occurs only if external anal sphincter is voluntarily relaxed. So the same exercise that we did, we can constrict our external sphincter if we are normal, alhamdulillah, and we will not pass stool unless we are at a proper place. What is the role of parasympathetic system? Parasympathetic defecation reflex involves spinal cord, S2, S3, S4. Stretch of rectum sends sensory signal to spinal cord. Splanchnic nerves return signal intensifying peristalsis. Then we have got contraction of the abdomen, which increase abdominal pressure, and difficult word from anatomy, a muscle called levator ani. This is elevating the anus. Levator ani, it lifts the canal upwards and feces, they fall down. This is the story of defecation reflex. My dears, 3 minutes for a quick look at hypothalamus, which is father of autonomic nervous system. Hypothalamus, I told you before as well, it is controlling all our body functions which are not in our voluntary control. It is controlling our heart, it is controlling our blood pressure, it is controlling our jo, yani hunger, it is controlling our shaba, yani fullness, but I don't want to eat more. It is controlling our temperature, it is controlling our shivering due to cold, it is controlling our sweating. Doctor, what are you saying? I am saying this. Just don't worry about MCQ. Just to make the concept. MCQ slide is different. Yani 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 nucleus we know in the small point which is hypothalamus. Regulate water balance, produce ADH oxytocin, destruction causes diabetes insipidus, paraventricular nucleus, temperature regulation, sympathetic, parasympathetic control, sexual activity, this. Can you believe? So many functions of hypothalamus. We have grouped them as some functions. So hypothalamus, it controls autonomic nervous system. It controls endocrine system. It controls body temperature. It controls emotions, our anger, our depression, our anxiety. It controls our reproductive system. It controls mother's behavior. You know mother's love with the child?
Yes.
Hope.
Oh.
So it comes from hypothalamus. Food and water intake, al-atash,
Yes.
hunger, ju. When we are full, hypothalamus stops us from eating. Satiety is shava. Thirst, atash. Hunger, ju. Circadian rhythm, 24-hour cycle phenomenon. You see, my age person or your grandfather age person, they are awake when you are going to sleep.
True.
If you don't trust me, check it.
I check everything.
You know, you are nowadays, you modern guys, you sleep at the Tahajjud time. And your grandfather and my age person, we awake at that time. You
Yep.
understand? And when we are coming from Fajr, you know, in fact, when we are going for Fajr Salah, some birds, they are already making sounds.
Right.
And when we are coming back from Salah, the birds, they are flying. This is called circadian rhythm. Maghrib, my age person, we start becoming like this. You start becoming active, you know. After Isha, you are on the Cornish side. And we are in the bed. This is called 24-hour cycle. It depends upon the light. It increases our cortisol, which is a stress hormone, at about Tahajjud time, so that I am ready for hard work in the day after Fajr.
Okay, Doctor. If someone sleep in on light, okay, it's effects on the
Definitely. That is why, did you understand his question?
Someone sleeps on
That is why when they put some terrorist or some hard criminals in the jail, Sijan, and if they want to ask them, where have you hidden the gold which you make sarka?
the
They are not answering.
Yeah.
So what do? One of the torture is this, that they put them in a
infrared.
place where all the time there is big light.
Oh.
And they just go crazy. Or in a place where 24 hours it is dark. They just go crazy. And they say, for God's sake, it is here. You understand?
Yeah.
Yeah.
And the terrorist organizations who train the terrorists, you know, they train their people for this dark and light cycle. That is when they go in if they are caught,
So pupils.
yes, and they go in the jail, they train them to just keep their eyes closed and keep lying so that this dark or light does not affect them and they don't tell where is their boss. You understand? These mafias and drug dealers and people like this, they train their persons like this. So very good question. This is exactly what you asked. This is what is circadian rhythm. If you read this for just enjoyment, I will not give it in MCQ. You will love it. This is a wonderful topic.
And thank you.